Arkansas's bold new initiative to ban so-called junk food from the Supplemental Nutrition Assistance Program, SNAP, marks a major shift in how one of the nation's most influential food aid programs might be reshaped to better support long-term public health. Governor Sarah Huckabee Sanders' plan, submitted for federal approval through the USDA, proposes a restriction on using food stamps to buy soda, artificially sweetened candy, and snacks made with flour, while also expanding benefits to include hot, prepared foods like rotisserie chicken. While the move is drawing pushback from advocacy groups and industry trade associations, it also opens a meaningful conversation about the role of public policy in shaping the health of future generations, especially among the nation's most vulnerable populations. The central message from Governor Sanders is clear. Arkansas no longer wants taxpayer dollars to subsidize food purchases that are scientifically linked to poor health outcomes. With a state burdened by one of the highest rates of diabetes and prediabetes in the country, Sanders is seeking not just to update what SNAP allows, but to confront the chronic disease crisis at its roots: diet and nutrition. This is not just a symbolic act of fiscal responsibility. It's a pragmatic step toward shifting SNAP from a reactive food assistance system to a proactive health intervention tool. Her statement that it's currently easier to buy candy and soda than fresh, prepared chicken resonates with anyone who has looked at the current state of American food deserts and broken nutrition systems and wondered how we got here. From a positive policy perspective, Arkansas is taking advantage of federalism's flexibility to experiment with a new approach that prioritizes long-term health. The effort has been enthusiastically supported by figures like U.S. Agriculture Secretary Brooke Rollins and Health Secretary Robert F. Kennedy Jr., both of whom are central figures in the Trump administration's Make America Healthy Again initiative. These leaders recognize that while SNAP was originally created to combat hunger, its impact has expanded into the broader realm of public health, whether intentionally or not. What Arkansas is doing is not shrinking the scope of support, but sharpening it. The plan is not about cutting funding or stigmatizing SNAP participants. It is about redirecting benefits toward foods that nourish the body rather than burden it with sugar, empty calories, and ultra-processed ingredients. This kind of policy realignment is supported by sound reasoning. According to Sanders, 23% of SNAP expenditures, amounting to over $27 billion annually, go to foods like soda, candy, and desserts. At the same time, the state spends $300 million a year on Medicaid treatments for chronic illness that are directly linked to dietary choices. From a purely financial standpoint, that's a cycle that cannot be sustained. But beyond the economics, there's a deeper human cost. Children growing up on high-sugar, high-carb, nutrient-poor diets are more likely to face academic challenges, behavioral issues, and lifelong health struggles. Changing food options could alter those trajectories in profound ways. The inclusion of hot, prepared foods like rotisserie chicken, which are often rich in protein and more satiating than a sugary snack, is another positive step. Previously barred from SNAP, these types of food are often more accessible to working families and those with limited time or resources to cook. By adding healthy options rather than simply removing harmful ones, the policy is not restrictive so much as it is reformative. It's about offering better choices, not fewer. Critics, including anti-hunger groups and industry lobbyists, have raised concerns. Some argue that food choice is a matter of personal autonomy, and that restrictions like these can be stigmatizing or fail to account for regional food availability. Others worry that defining junk food opens a legal and logistical minefield. While those concerns are not unfounded, they often overlook a critical truth. Personal choice in food is already limited for low-income families, not by policy, but by economics, availability, and aggressive marketing from food conglomerates. The SNAP program is already a structured benefit. It does not permit alcohol, tobacco, or hot food in most cases. Adjusting those parameters in a direction that promotes health is not a radical leap. It's a natural evolution. This initiative also puts pressure on federal agencies and policymakers to take the next step, make healthy food more affordable and more accessible. Reforming SNAP is just one pillar. Others include investing in food infrastructure, revitalizing rural grocery markets, incentivizing local farming, and strengthening school lunch programs. By making the SNAP benefit more nutritionally targeted, Arkansas is laying the foundation for these broader systemic changes. Governor Sanders has also been mindful to ensure that the conversation stays grounded in respect and logic. Her comments about removing the state grocery tax and her emphasis on hunger satisfaction underscore that this policy isn't designed to punish. It's meant to bring balance and dignity back into a system that was never intended to support junk food addiction. By approaching the issue holistically, addressing Medicaid costs, food access, and nutrition in one policy move, her administration is setting an example for how state leadership can tackle complex public health issues without waiting for federal mandates. This may not be a one-size-fits-all solution, and the implementation will require careful oversight, public education, and responsive flexibility. But what Arkansas has done is introduce a model that prioritizes health equity through better policy design. It suggests a future where federal benefits don't just fill stomachs but foster wellness, and where long-term care costs are reduced not through austerity, but through smarter, health-driven choices. If other states follow suit, and if the USDA supports innovative, evidence-backed reforms, this could be the start of a national shift in how America thinks about public assistance, nutrition, and preventive health care.